Hello everyone, welcome to our YouTube channel. Extraction is a painful process for the patient, but at the same time it is challenging for the operator as well. While routine extraction of anterior as well as posterior teeth is easier for the operator, it is challenging to do extraction of wisdom teeth, more so with mandibular wisdom teeth or mandibular third molars because of the hardness of the bone and density of the bone. In today's case, we are going to see extraction or rather minimum invasive extraction of mandibular third molar tooth, which is fractured. It was root canal treated long back, almost 10 years back. Patient had dislodged crown and now it got fractured and is giving pain to the patient. We have planned extraction of the tooth using splitting of the crown, periotome use, as well as using luxators for extraction of root pieces separately, and this will be followed by use of a hemostatic agent as a void filler to fill the extraction site, and to cover it we are going to suture the gingival margin or the flap margin on top of it. So let's go ahead with the case. Here is the case where patient has presented with a fractured lower left third molar or mandibular left third molar. Due to the fracture, the routine elevation and forceps extraction was not possible and a more controlled surgical technique was required. The tooth has a history of root canal treatment and a dislodged crown. In the X-ray, we can see the root canal filling and joint roots while the crown structure is damaged. So we are kept the instruments ready, that includes periotome, luxators and tooth extraction forceps. Also, for the hemostasis as well as void filler, we have kept the hemostatic agent, that is hemocol, which contains type 1 collagen. The required quantity is taken out from the vial and is kept ready to be placed after the extraction. For the extraction specifically, we are using periotomes, that is the instrument of choice for minimum invasive extraction or atraumatic extraction. It comes in variety of tips, that is straight, angulated or curved depending on the site. So after the anesthesia is given, we have started using the periotome to sever these periodontal ligament fibers on buccal, interdental as well as lingual and distal surfaces. After the periodontal ligament fibers are severed, we are going to try and make an attempt using the luxator first. Here we can see the periotome being used on the distal surface of 3/8, on the buccal surface. Now we see the use of luxators being used on the interdental area between 7 and 8. Now because the tooth is not giving up and there are chances of fracture, so instead we are going ahead with splitting the crown, and two roots separately we are planning to extract using the luxator. So this is the luxation process being shown for the mesial root of 3/8, and subsequently both the roots will be extracted separately. After the extraction, you can see the extraction void. This is the view of the regular view as well as the mirror occlusal view of the same. To help in the early hemostatic as well as inflammatory phase of the wound healing, we are using this type 1 collagen, which we had kept it ready before extraction. It comes in sponge form like this, and we are packing it into the extraction site not only for hemostatic purpose but as a void filler. So once that is gently packed into the extraction site, we will be able to achieve hemostasis in about 3 to 4 minutes. This is the view after around 3 to 4 minutes, both occlusal view as well as the direct view. So once hemostasis is achieved, we are going to keep the same type 1 collagen inside the wound as a void filler, and we are going to suture the flaps using simple interrupted sutures. So this is the video showing two simple interrupted sutures being placed at the site of mandibular left third molars. So we have seen management of fractured mandibular third molar using minimum invasive instruments like periotome, then splitting the roots using rotary burrs, and finally using luxators for efficient extraction of the root pieces. This was followed by use of collagen sponge for hemostasis as well as to aid in healing and acted as a void filler during the healing process. Hope this video helped you in some form about minimum invasive extraction therapy. Hope to see you all in the next video. Till then, see you.